Uh, well, now I guess a couple of you have heard of Michael Yapko. Um, I was at the Ericksonian Congress a number of months ago, and Michael was introduced by Jeff Zeig. Um, and when Jeff introduced him, he said that Michael is the Milton Erickson of the 21st century. And that about sums up the impact that he's had on the field of psychotherapy and hypnosis over the past 40 years. He's written Trance Work, which is the definitive textbook in hypnosis. It's in its fifth edition now. He's authored 15 books, many on depression, to which he's devoted his life, and he's one of the world's leading experts and authorities. His 100-hour trainings are the most comprehensive trainings you can imagine, and once you leave the training, the mentoring doesn't stop. He continues with phone calls. He makes himself very available. He becomes a friend with true personal relationships. One last comment before I fully introduce him. Well, Michael is Michael Yapko, but as many of us know, that's not the whole story. I'm not sure Michael would be who he is without Diane, his wife. Diane is in lockstep with him. She helps guide him, helps him with all that he does. And although she's a silent partner, she really deserves our recognition as well. And I need to thank Diane for everything she's done over these years. So without further ado, let me introduce Michael to everybody here. Michael?
Thank you, Peter. Thank you, Dana. Thank you for that really amazing introduction. I wish I could live up to that somehow. Good evening, everybody. I'm really pleased to have the opportunity to talk about these issues. Dana has done an amazing job, and Peter have done an amazing job of wanting to address these things and trying to mobilize the hypnosis community to pay attention to this very, very strange and chaotic set of times that we're living in. And so there's a lot that we can do, and I want to just share a few ideas with you about where we are in the grand scheme of things. Let me get my slides up. I want to remind you that this is being recorded, and you will be sent the link to the recording. You will receive the slides, so you don't really need to be too concerned about taking copious notes or anything like that. There's a lot of information I want to present. More than that, I want to present some perspective, and I want to try and do all this in a relatively short period of time. But this global pandemic now has, especially here in the United States, I know many of you are living in other countries. Australia has really managed this well by comparison, but we have learned a lot about who gets anxious and depressed and who doesn't. It highlights many of the things that we've known for a very long time about what the predisposing factors are. And this is, in many ways, what I've spent my professional life doing, to be able to recognize that in the same way that we can talk about somebody who smokes cigarettes as being at risk for lung cancer and cardiovascular disease and a lot of other kinds of issues, we can say that somebody who has this particular cognitive style, this particular relational style, this particular coping style, and many more such patterns, places somebody at a considerably elevated risk. And so even as we're dealing with people during this pandemic, and of course, all the after effects yet to be observed, but you can predict they're going to be difficult ones. And many people predicting that the next pandemic will be the mental health pandemic. And the evidence is certainly suggesting that. To give you a little overview of what I'm going to talk about and then start to get into some of the data, I first want to share some of these data about what is the current state of mental health. The CDC has been doing regular weekly polls and surveys about the mental health of Americans, and the data are really very revealing. Then we can talk about some of the specific unknowns of COVID-19. What are the psychological consequences of uncertainty? And how do we help people deal with all of these uncertain aspects of this pandemic. Then we can briefly talk about, well, why hypnosis? Why are we even talking about these kinds of things, particularly when so many of our professional colleagues don't really understand hypnosis, don't particularly want to understand hypnosis. And yet, as we are starting to integrate what we're doing into more and more different healthcare systems, people are starting to realize that we can't just treat a virus. We have to treat the whole person. And that's when hypnosis becomes enormously valuable. And then I want to share with you at the end a step-by-step strategy. It's not a particularly easy one, but neither is the problem. But this is really meant for all of you who are hypnosis practitioners, who have a solid foundation of experience with hypnosis, that, of course, anytime you do a hypnosis session, it's for a reason. You know, hypnosis is unapologetically a goal-oriented kind of a process, but it's also a complex process with many moving pieces to it. It's not just as simple as do an induction, give somebody a suggestion. So I'm going to go through this procedure with you for recognizing and tolerating ambiguity, and hope that it inspires you to use parts of it or all of it in working with people who are concerned. Well, these slides have a little more data than is worth reading, but just to give you a sense, again, you'll get these slides, so you'll get the details of it. But the CDC released new data just 2 weeks ago that showed how many people in America are suffering from anxiety disorders, how many of them are experiencing depression, reporting the onset of these symptoms just in the past 7 days. So this is data derived from more than 42,000 people during the week of May 7th and 12th. And the fact that so many people were experiencing symptoms of anxiety and depression really is not much of a surprise. But what it does highlight, and I think should amplify in every clinician's mind, is that for as much as people have been talking about depression as an illness, just like diabetes or just like heart disease, I've been arguing for years, and in fact wrote a book called Depression is Contagious. And when I wrote Depression is Contagious, it was because there was so much information in a number of fields, but none of these fields were talking to each other. And I'm talking about the fields of genetics, epigenetics, affective neuroscience, cognitive neuroscience, epidemiology, and well, many different fields that all independently came to the same conclusion, that what drives depression in most people's cases, the great majority of people's cases, is environmental conditions. And yet, somehow, the use of antidepressant medications has been the most common form of treatment. And I really speak to all the things that medications cannot do, not just will not do, but cannot do. And what it really then speaks to is how vitally important you are, that no therapist should be feeling like they are a fifth wheel, or somehow medication is the primary treatment approach and therapy is superfluous. What you do cannot be replaced. And the importance of being able to talk to people, the importance of being able to empower people to acquire specific skills. Well, when we talk about predisposing risk factors, why are some people moving through this pandemic and they're doing okay? I don't know that anybody's doing great, but people who are doing okay versus people who are really going down in flames. And these predisposing risk factors play out in a number of different ways, but the one I've chosen to focus on this evening is how people deal with ambiguity. Long before the pandemic hit, we've had massive amounts of evidence. It's a very robust research finding, nobody doubts it, that people who are prone to anxiety and depression have a very different way of responding to ambiguity than people who are not prone to anxiety and depression. And really the challenge to a therapist is, what I've been interested in is, for people who don't have that particular skill set somehow innately or never learned it along the way, is this a learnable skill? Is it a teachable skill? And of course, the answer is yes. And that's really what this strategy is about that I'm going to be speaking to a little bit later on. But to continue with some of the data, just to show you a couple of graphs, you know, the COVID-19 has not hit everywhere in America in the same rate of prevalence. Some states and locales that have been hit far harder than others. And this particular chart shows you some of the most high-risk areas. Mississippi, nearly half the adults in Mississippi showed signs of anxiety or depression. Missouri has a very high rate. Illinois has a very high rate. But you see the kind of distribution here, and it certainly tells you something about who is currently suffering and some of the lower numbers of people who are at risk. This speaks to the anxiety symptoms of all adults, and it breaks it down demographically by age group. And when you look at who suffers to the greatest extent, it is the age group, the demographic group of the 18 to 29-year-olds. And that is, of course, troublesome. You'll see the same thing in the next slide where we're looking at depression symptoms. Once again, when we look at prevalence, it's the 18 to 29-year-olds who have the highest rate of prevalence. Now, we can speculate endlessly about why that's the case, but it is a frightening statistic because what we've also been seeing is a very marked rate of increase in suicidal tendencies, suicidal behaviors, and actual suicides. And from a mental health perspective, if we don't get help to people much, much sooner and take this aspect of it much more seriously, we're not going to just continue to lose people to the virus. We're going to continue to lose people to depression and suicide. But looking at the fact that there is no age group that has been spared and no age group that's going to be spared, but the epidemiology is very worrisome, and it's something that we need to pay more attention to. Here we look at the breakdown according to economics, that the people who are suffering to the greatest extent are the people in the lowest economic brackets. Now, that's really not much of a surprise. And when you see the people who have the highest level of income, they also show the least amount of worry. And it's not that they're not concerned at all. Of course, people can't not be affected by what's happening in terms of the economy and all of the dominoes that are still falling. There's a lot that we still don't know about what's going to happen. How many jobs are going to come back? Will the economy recover? How many years will that take? This is certainly not going to happen in the next 3 or 4 months. It's probably not going to happen in the next 3 or 4 years. The hits have been really, really serious. But it highlights again that for people who have the economic resources, they are better positioned to cope with these things. And it highlights again one of the reasons why people are out marching in the streets as we speak, highlighting the economic inequities, the social inequities, the demographic inequities on a variety of criteria. So we have a lot of work to do. And that work all falls in the realm of how do we empower people to accomplish the things that they need to accomplish in terms of coping and rebuilding. You know, if we're ever going to talk about resiliency, now's the time. And what the components of resiliency are and what the things are that we can teach people that can really make a difference. Well, moving on then, you know, the theme of tonight, to Dana's credit, was the ambiguity of all of this. And I think she was exactly right to choose that as the primary topic, because it is the ambiguity that drives everything else in ways that I'll describe in just a moment. But it's easy enough to appreciate what the ambiguities are that we're talking about. We don't know how COVID-19 is spread. Is it spread as an aerosol like measles or as a droplet like the flu? We don't know how long it stays on various surfaces. We don't know whether it's spread by human waste. We don't know what the true case fatality rate is. We don't know how and why it causes such a wide variety of clinical syndromes. We don't know whether it can or does spread through air conditioning systems. We don't have a cure for it yet. We don't have a treatment for it yet, much less knowing what really works. We don't really know how efficacious these masks that we're using really are. We don't know how long people are infected before they start to have symptoms. We don't know what percentage of people can be reinfected. We don't know what the long-term effects are going to be from having the virus. We don't know whether it's 6 feet that's best safe social distance. Now some research saying 10 feet. Yesterday another study came out and said 30 feet. And of course, that's not going to happen. 10 feet's not going to happen. People are having a hard time with 6 feet. We don't know when it's really going to be safe to begin socializing again. People predicting big spikes now from all the people out in the streets protesting that aren't wearing masks and aren't keeping any distance. So the epidemiologists are very, very worried about that. When is it going to be safe to travel again? When should I start seeing clients face to face again? Will my job come back again? We look at all the uncertainty. Well, certainly we've had plenty of evidence long before the pandemic that uncertainty drives the intensity of people's emotions. And these authors that published this particular research study in the journal Emotion a little over 10 years ago said quite clearly, anything that impedes our ability to understand, anything that promotes uncertainty about the nature of an event is going to prolong affective reactions to that event. Part of what drives not just the intensity, but the duration is how much ambiguity is associated with it. Now, up until the pandemic, my focus was entirely on comorbid anxiety and depression. And in fact, from a purely diagnostic point of view, anxiety and depression are most frequently found as comorbid conditions. Statistically, it is unlikely to see somebody who just has depression without also having a coexisting or comorbid anxiety disorder. So we end up treating both of those things, and uncertainty fuels both. And here's how. The two primary targets that we're aiming at when we're wanting to address ambiguity in somebody's experience. We're dealing with the process itself of a low tolerance for ambiguity, and then the rumination as a coping style that drives the anxiety and depression. Rumination is a very common coping style. It's particularly common amongst therapists who get paid to analyze things. And what rumination is about is analyzing and analyzing and analyzing, and then analyzing some more at the expense of taking effective action. Well, we have plenty of research evidence. Again, this is not open for debate. The research is robust and very conclusive about this, that the more somebody ruminates, the more anxiety it generates and the more depressive symptoms it generates. And the strength of that research is that it is not retrospective, it's prospective. That we can say right now that somebody who is a ruminator who is not depressed compared to somebody who is a ruminator, but if both, or somebody who's not a ruminator, and both of them face some kind of stressor, the person who is a ruminator is far more likely to suffer an anxiety disorder or a major depressive episode. Rumination predicts people's response. This is one of the risk factors. So this is where each therapist really has to consider for themselves how action-oriented is your treatment. If you are somebody who encourages people to think and analyze and journal and talk about their feelings, you might unintentionally actually be working against your clients. Journaling is just rumination in writing. You have to be careful about not wanting to encourage rumination. We want people to be able to take action. And the kind of action that they can take, you know, why so many people keep watching the news and watching the news and watching the news. We understand why they're ruminating. They're trying to understand it. They're trying to get a handle on it. They're trying to figure out what they can actually do about it. The problem is, in terms of externals, there's really not much that they can do. Where the action's going to be is internal. How do I regulate my own internal experience in this environment where there is no action for me to take? I'm not going to be the one who researches and finds the vaccine. I'm not going to be the one who makes the virus disappear. I'm not going to be the one who somehow changes the healthcare system to make it more responsive to people. I'm not the one who's going to be able to get people to put their masks on and help people understand why social responsibility is more important than ever. And just as a side comment, all those people who are yelling and screaming about their right to not have to wear a mask if they don't want to, if they're complaining about a mask, I can tell you they're really going to be complaining about when they're on a ventilator. But if you can't make the discrimination between what's personal and what's not, if you think that wearing a mask is about your personal freedom instead of your social responsibility, then there's some learning curve that you need to go through. Well, talking about the ambiguity and its relationship to rumination, the anxiety expert David Barlow, wonderful psychologist, he's won every award you can get as a researcher. He's at Boston University, and he has after all these years of treating and studying and researching anxiety disorders, he has a very simple way of saying who's at risk for anxiety disorders, and related to that, depression, since anxiety typically precedes depression on average by about 5 to 7 years. High levels of anxiety represents a risk factor for comorbid depression. But his take on it is that for people who are most prone to anxiety disorders, they do two things reliably. They overestimate risk and they underestimate their own personal resources. Well, here comes the hypnosis side of the equation. What hypnosis does best, arguably, is it connects people to their personal resources. And contrary to the myths about hypnosis, hypnosis is all about empowering people. If hypnosis was about disempowering people, it wouldn't interest me. Nobody ever comes into my office, sits down and says, "Hi, will you help me lose control of myself?" On the contrary, the reason why people are coming into therapy is because they want more control over their experience. And hypnosis, fortunately, is a very expedient way to provide that increased connection to their own innate resources. The problem is human nature here. People strive to understand meaning. That's human nature. We are story factories. And when people encounter an ambiguous stimulus, people's anxiety increases. People want to understand. They want to know what's going on. And it's why, even in the face of uncertainty, when people can't figure out what's going on, they make stuff up. They make stuff up. And the problem, of course, is not just that people make stuff up, but even worse, they believe themselves when they make stuff up. And here we are at a time when you've got a country filled with people that do not know how to recognize and distinguish fake news from real news. People don't know how to distinguish what's real from what's not. We have failed people miserably in terms of teaching them how to think critically. And our education system needs an overhaul. The fact that people buy into these conspiracy theories that are nothing short of preposterous, they hear this conspiracy theory, and instead of saying, "That's ridiculous," they go, "Wow, I didn't know that," and actually believe it. This is problematic. Well, one of the reasons why people generate all these cognitive distortions, why CBT is so valuable for so many, is that one of the cognitive distortions of jumping to conclusions is a direct response to people not being able to tolerate ambiguity. They'd rather have an answer, even if it's a wrong answer, than saying, "I don't know." So the goal here is, from a therapeutic perspective, we need to help people get comfortable with tolerating ambiguity. And in order to tolerate ambiguity, you would first have to recognize it. A lot of people don't recognize an ambiguous situation. How do you know when you're facing an ambiguous situation? The easiest way to know is when there are multiple explanations for it that are possible, plausible explanations. In other words, we can explain this same phenomenon in 5 different ways. Why didn't the person respond to my email? How many different reasons can you generate? Why didn't the person say good morning back when I said good morning to them? How many different reasons can you generate? That's how you know you're dealing with something that is innately ambiguous. So we want to provide those skills to recognize and tolerate ambiguity. And some of those skills are, first, recognizing ambiguity in and across situations. What are the situations that are innately ambiguous that you'll never be able to answer, where we can ask all kinds of questions? But you see the same thing happening with the pandemic. People who, they can't just say there's a virus out there. They have to say this is God's punishment. And instantly they give it a meaning that satisfies them in some weird way. But rather than saying, I don't know, or trying to understand it in biological terms or social terms, just doesn't occur to them. Recognizing multiple possible meanings. Recognizing when there's no clear evidence that's obtainable, at least right now. Maybe eventually we'll understand how the virus gets spread and what we need to do about it. Maybe we'll have a better understanding of its structure so we can develop a vaccine. You know, there are coronaviruses out there that have been around for years that we still never developed a vaccine for. We don't know what's going to happen with this. But it sure helps to be able to say, I don't know. From my standpoint, being able to say, I don't know, is one of the most sophisticated cognitive skills that you can possibly develop. Well, when we look at rumination, people asking the questions over and over and over again, will life ever get back to normal? I understand it's people wanting some control. It makes them feel better if they think that they know what's going to happen. And certainly, again, long before the pandemic, we had plenty of evidence, a whole slew of studies about the phenomenon called stress inoculation, that when people know what the stressor is that they're going to be facing, they do better than when they're caught off guard. So I get that. The problem is we don't have predictive ability right now. People who mistake rumination for action. This is, to me, one of the interesting things, that when you interview people who have a ruminative coping style, they think that by analyzing the circumstances, they are doing something. Well, analyzing isn't the same as action. And to think that by analyzing things more and more and more, that somehow you're doing something, is really self-defeating. So there is a discrimination. And when I wrote the book, The Discriminating Therapist, I identified many, many different discriminations somebody would have to be able to make if they're going to live well. Here is one of the many discrimination skills somebody would need to have. Others as well. How do you know what's controllable and what's not? How do you know what you are responsible for and what you're not responsible for? But this one is, how do you know when something, when you're engaging in useful analysis versus when it's simply useless rumination? And I'll answer that. How do you know? When, if it doesn't lead to timely and effective action, it's useless rumination. Okay, so we're using hypnosis then to encourage behavioral activation. The goal is to impart the skill of recognizing and tolerating ambiguity, but that we're encouraging behavioral activation. That just the mere act of doing hypnosis with people, engaging them in the process. Hypnosis is a very active intervention. And people sometimes mistake that the fact that the client's sitting there with their eyes closed and they don't seem to be really doing anything right now, inside they are processing actively everything you're saying. When you offer them metaphors, they're engaging in the search for relevance. How does this apply to me? It's a very active process of how can I take these suggestions and integrate them and make them work. And all of that is internal, but it's active work. And that's really what we're encouraging when we do hypnosis. We're also going to use hypnosis to seed homework and experiments and things that people can do out in the world that might make a difference as well. So why use hypnosis in responding to these COVID-19 related issues? I think the reasons, arrive with some degree of fanfare. There's certainly good evidence hypnosis enhances treatment outcomes. It gives us a lot of insights into people's experience. It highlights the malleability of people's experience as we help them shift from a static perception to a dynamic one, that this is changeable. Enhances people's sense of control. We can use it in many different ways. If you think about the strategies that both Dana and Daniel provided us, they speak to very different elements of somebody's experience. Some of the suggestions speak to the physical part of someone's problems. Somebody else focuses on the cognitive part. Somebody else focuses on the behavioral part, the spiritual part, the emotional part, the relational part. What are we really going to be focusing on? What do we want to amplify? Cognitive, behavioral, and emotional flexibility, helping people really develop the recognition that even if I can't change the circumstances, I can certainly change my own response to it. Well, coping skills, teaching self-hypnosis, I think Daniel's technique can be valuable in that respect, and reducing the drive for certainty when you're not going to get it. Okay, let's move forward into the strategy itself then. What I'm going to describe to you now, I'm going to skip that and you can look at that one on your own. What I'm going to describe to you now is a strategy that I've been working with, polishing, elaborating for the last quarter century. My clinical practice has heavily focused on the problem of depression. That's what many of my books have been about. My two main areas of focus, hypnosis and depression. And you can't treat a depressed person who isn't going to have some ambiguity about what's controllable, what they're responsible for. And ambiguity comes up over and over and over again. As I mentioned earlier, ambiguity represents a very strong risk factor for depression. So I offer you this strategy. I'll describe it step by step, and then I'll wrap this up. Well, hopefully you'll find parts of it or all of it useful to you. All right, so as with any hypnosis session, there's a beginning, there's a middle, there's an end. Orienting the client to hypnosis, whatever way that you say, okay, now we're going to do hypnosis, arrange yourself in a position that's comfortable, here we go. The induction process, whatever kind of induction you're going to use. My personal style is a much more conversational approach, a much more permissive and naturalistic approach. But again, whatever you do for an induction, that's obviously okay. Building a response set regarding uncertainty. If you ask me what is the single most important phase of any hypnosis session, not just this one, I'd say it's how much time you spend building a response set. If you don't build the momentum of responsiveness, all the things that you're going to do later in the session are really going to fall flat. If you want to know one of the main reasons why sessions don't succeed, it's when therapists don't spend enough time building the response set. Well, in this case, as always, when we do a hypnosis session, we're going from general to specific. So I'm introducing in a general, impersonal way the notion of ambiguity that I'm going to be coming back to and elaborating a little bit later in the session. So to offer suggestions about uncertainty as it applies to this interaction. You're sitting in front of me, you really don't know what I'm going to say, you really don't know what you're going to discover, you don't know what's going to be valuable to you, you really don't know, you really don't know, you really don't know. I'm making that a part of the process. And the only thing the person can say to themselves is, that's true, that's true, that's true. I don't know what he's going to say. I don't know what I'm going to experience. I don't know what I'm going to discover. And just like that, it makes ambiguity tolerable within the interaction. Now let's move on. Let's talk about the process of inference. When people make inferences, but they don't know they're making inferences, that's a big problem. What I was saying earlier about people making projections and making the mistake of actually believing themselves. So I want to normalize that. There's nothing wrong with making projections. It's what we do. It's why there are more than 800 different forms of psychotherapy right now. You got therapists all over the place that make projections about the nature of people's problems. It's what we do. The question is, can we help people know when they're doing it, instead of just jumping to a conclusion without questioning it and then thinking that that's really the way that it is? There are therapists who love the idea of an inner child, for example. Well, the inner child is a metaphor. If you're not pregnant, you don't have an inner child. But people start building their therapies around the notion of an inner child as if that's a real thing. It's a projection. So let's not treat it as if it's truth. It can be a useful projection, but it's just a projection. So then the next step of the process is the suggestions we use, the metaphors that we use about how we make projections that often serve to protect us, or so we think. That we generate these things, we generate these understandings in order to feel better. So now moving to the next step. Let's align ourselves. Here's the therapeutic alliance getting built and getting reinforced. Let's talk about first the value of knowing. I understand why you want to know. It can inspire you. It can give you confidence to know that when you're trying to make a decision, that you want to know what the facts are as best as you can get them. So if I'm going to use as a metaphor that I needed to buy a car, and so I wanted to buy a car that had the best possible gas mileage. Well, if we ask the question, so what car gets the best gas mileage? That's a researchable question. That's an answerable question. We can do the data analysis to find out which car gets the best gas mileage. So the value of knowing, when we have decisions to make where we actually can know, we're reinforcing that. What it leads to is being able to ask the question, can we distinguish between answerable questions and unanswerable questions? Our clients can ask us questions routinely that no amount of analysis is going to yield an answer to. When I have this young mother in my office who is crying her eyes out because her 2-year-old died of leukemia, and then she asks the question, why? Why did this happen? Why me? Really? Is there any answer I can give her that's going to make her okay with it? It is an unanswerable question. I understand trying to understand it. So the metaphors, the suggestions about the value of knowing. Then moving to the next step, the value of not knowing. There are some questions that people ask that we really don't want to answer. We don't want to have answered. We've got a couple hundred people on this call, and if I had the chance to ask each of you the question, if I could tell you the exact day, time, minute, second of when you're going to die, would you want to know? And if there's 200 people, let's say, on this call, I am willing to bet that 195 of them would say, hell no. They don't want to know. There are times when not knowing is actually advantageous to your mental health. So to use a less emotionally charged metaphor than dying, I can offer, for example, going off to college and wondering what I was going to do with my life, and being open then to taking a lot of different classes and finding out what I had an interest in and what I would develop a passion for, and all the things about not knowing. Or if you've had a child, did you want to know the gender of the child before it was born? Some people say yes, some people say absolutely not. I want to be surprised and happy at the last minute that as long as a baby pops out with 10 toes and 10 fingers, I'm good to go. So being able to provide that discrimination, when not knowing is a good thing, when not knowing is desirable, we're trying to do what's called induction of affect in hypnotic terms. How do we induce an emotional state of being able to reach acceptance and tolerance for the experience of not knowing? So this is the time when we're providing those kinds of cues. Right now, this is not answerable, the pandemic's resolution. Maybe it will be in 3 months, maybe it will be in 3 years. We'll see. So we just don't know. To use the time to seed homework assignments. You know, somebody asks me an unanswerable question, I can do a hypnosis session that revolves around answerable from unanswerable, and then I can follow it up with the homework assignment. I want you to make a list of unanswerable questions, and let's put that question as number 1 on the list. Post-hypnotic suggestions for integration of all of these insights and skills. Closure, disengagement, session's over. So there's a lot that's packed into that session, and it may be one hypnosis session, it might be several hypnosis sessions as you fully develop each of these points. But keep the goal in mind. Keep your eye on the ball here. What we're striving to do is make ambiguity tolerable. That instead of it raising anxiety because of all the negative projections, we're trying to do something to stem those negative projections that are so scary and depressing, and help the person reach a point of, I don't know. To be able to live in the present now. You know, most people know my therapy is very future oriented, building a compelling future that pulls people forward. But here and now, under these current circumstances, life really is about getting able to cope with day to day. And there will come a time later when we can start to plan again, long-term planning. But for now, it's how do we get through the next day? So anyway, that's where I'm going to stop. I hope that that is valuable to you. I thank you for your attention. I want to just share, there's a review slide that you'll see in your handouts. I do just want to share one thing, if you don't mind. I have spent the last 1.5 years working with 2 very bright entrepreneurial brothers from Melbourne, Australia, on a phone app called Mindset. I hope that you will check it out. It's available on iPhones right now. It will be on Androids later in the year. It's also available, you'll find it on my website, the link to it, yapko.com. But here are dozens of hypnosis sessions addressing all of these kinds of topics. And it is a subscription service, but it is incredibly cheap, less than half the price of a face-to-face session for a full year. And I am really proud of the quality of the hypnosis sessions that are provided. 24 hours a day, 7 days a week, people have access to these kinds of sessions, just like the one I've described to you. And I'm hoping that you'll check it out and certainly recommend it to your clients as a way of reinforcing the things that they're learning from you, but the fact that they can have so many really great quality hypnosis sessions available at their fingertips. So thank you for your attention. You can visit my website where you can sign up for the newsletter, check out Mindset, learn about the hypnosis training programs. Thank you so much. Back to you, Dana.
Okay, Michael, that, as usual, was just amazing. And I also want to say too, please, I see lots of chats are surfacing on my screen about how wonderful the Mindset app is. And also, if anyone wants to find out more about it, I know Michael suggested going to his website, but there's this wonderful conversation on Michael's website that he has with the 2 brothers who are, you know, the geniuses behind the app.
The outfit, yeah.
and I love the conversation, and I'm sure you folks will too.